tuned in to the Andrew Lawton Show.
All right, well, let's talk about British Columbia. I was in Vancouver for a very brief period of time last week and actually got the chance to see my next guest speaking. He's been following this issue in a way that very few in the media are, and I would say having a little bit of success. Now, British Columbia did a significant about-face last week on this 3-year decriminalization project they have in their province, where for 3 years you cannot be criminally charged for using drugs in most public spaces. We're 1 year into the 3 years, and BC has had enough and said, no, please, we don't want to do this anymore. They've now asked the federal government to essentially reverse this project, and the federal government is not yet committing to it. This is a clip from Yara Sachs, who is the federal addictions and mental health minister, talking about how, well, this isn't even really a criminal issue.
I'd like to know what your reaction is to BC pulling back on decriminalization.
Well, at this point in time, I met with Minister Whiteside in BC on Friday, and we are reviewing the request to the exemption that they put forward to us. We're sitting with Health Canada officials at this time, but we are wholeheartedly committed to continue to work with BC. They requested this exemption from the federal government with a full plan for a suite of tools to address the illicit toxic drug supply and the overdose crisis. Our commitment is to keep this firmly in the frame that this is a health care crisis and it is not a criminalization issue.
How quickly do you think you can act? So BC has asked you to take these actions, and as you said, you met with the minister. How quickly can you respond and give them what they're looking for?
Well, considering I only received the letter on Friday and today is Monday, it is under review with officials at this time.
Are you committed to decriminalization? If another jurisdiction, I know Toronto, for example, has an application to allow for decriminalization, would the federal government be in the position, given BC's experience, to be granting more exemptions for decriminalization?
So I think we need to go back to first principles of policy here. In addressing the illicit toxic drug supply and the overdose crisis, we know as a federal government that we work with jurisdictions on a case-by-case basis, making sure we have a full suite of tools available to help vulnerable populations. That includes prevention, that includes harm reduction, that includes treatment, and that includes a full set of health considerations. At this time, Toronto's request is under review. We look at this case by case. It's not an apples to apples situation, and we continue to partner and work with jurisdictions.
To be clear, decriminalization is still something you would be prepared to go forward with and grant in a jurisdiction?
The overdose crisis, as I've said before, and I say again, is a health crisis issue. It is not a criminal one.
Not a criminal issue. Well, British Columbia is saying, well, we kind of think it should be a criminal issue again. And BC, this is not some ravaging right-wing conservative government here. This is the NDP government, which has been one of the most effectively drug-permissive governments in the Western world on this, certainly in Canada. And Minister Yara Sachs is now fine with just slow-walking BC's request to get out of this and still actively considering the request from Toronto. This was another clip from that same scrum that I found interesting when, let's just hear it from her words.
What does this tell us about the decriminalization tool, though? I take your point, it's a suite of tools, but this is one of the tools. What's the lesson here about that tool?
We are 1 year into a 3-year pilot, and we continue to work with the BC government to evaluate.
What went wrong in your mind? Because 1 year in, BC's already saying we got to pull back and it's too much. So what went wrong here?
1 year in, we're still evaluating the data and working with BC. Thank you.
Oh, it's just 1 year in. We don't have the data yet. Okay, well, you want to do 2 more years of this, Minister Sachs? Is that really what you think people need? Joining me is Adam Zivo, founder and director of the Center for Responsible Drug Policy. Adam, I know that there are people whose lives and livelihoods are at stake here, but you must have a bit of I told you so with your work on this, and now even BC really seeing the error of its ways to some extent.
Well, so, I mean, the failure of this experiment in BC was completely predictable. I actually wrote an article for the Washington Examiner predicting everything that we saw. And there's a clear reason for this. There are a variety of different ways that you can decriminalize drugs. And some models of decriminalization are actually fairly sensible and have had positive results in the past. For example, Portugal. But what BC did is decriminalize drugs in the least responsible and laziest way possible. So I'm going to go back to Portugal and explain what they did and how that contrasts starkly with what we saw in Canada. So Portugal, in the lead up to decriminalization in the early 2000s, they spent years investing into their treatment capacity to ensure that anyone who wanted to get better could easily get into rehab. Then, when they decriminalized drugs, they didn't just let people do whatever they wanted like we saw in BC. What they did is they created a parallel justice system where if you were caught openly using drugs or possessing the small amounts, you were sent to a non-criminal dissuasion commission composed of a social worker, a lawyer, and a psychologist. And that commission could use punitive measures, including fines, to coerce you into treatment. So what this does is it ensures that there is some level of accountability for people's actions and that there is a mechanism in place to push you into rehab, which is very available. BC did none of that. They didn't invest in treatment. They had no mechanism in place to divert people into recovery. They basically said, well, if you destigmatize drugs, that'll increase treatment uptake. And there's no real evidence behind that hypothesis, which turned out to be spectacularly incorrect.
Yeah, and I mean, the fact that they're seeing this so early on, I think, is noteworthy because this was a 3-year trajectory. So they, I guess, assumed that it was going to take them 3 years to be able to see if this was working or not. And now a year in, they're basically tapping out. Now, maybe there is a genuine conversion here, or maybe they're realizing, hey, we've got an election coming up in October and this isn't working, or maybe a little bit of both. But do you think the election is more of a driver to a recognition of wrong? Because they haven't been showing any real contrition on their approach, even as recently as a couple of weeks ago.
I would say so, because when you look at the BC NDP, they've basically done the bare minimum to roll back decriminalization, safe supply. You kind of have to force them to do a kicking and screaming. For example, decriminalization was immediately disastrous. And last year, throughout the summer of 2023, people expressed a lot of concerns about public disorder. Only when those concerns became impossible to ignore did the provincial government try to amend decriminalization to recriminalize open drug use in public places through provincial law. Then, of course, the Harm Reduction Nurses Association launched a lawsuit against the provincial government and managed to get an injunction which prevented Bill 34, which was the law that recriminalized drugs at the provincial level, from being enforced. And that injunction was granted in January. So at that point, David Eby could have asked the federal government to step in. He could have been proactive, but instead he's like, well, you know what, like it's in front of the courts now, what can we do? And I think it's notable that he only went to the federal government now when there is polling showing that support is consolidating behind the BC Conservatives, who have a serious shot of displacing the BC NDP in the October election.
Yeah, and I was wondering if you could then go to the federal perspective on this and why the federal government is not really being responsive, it seems like, to the same polling. I mean, we heard from Minister Sachs in that clip I played a couple of moments ago, and they're basically not even committing to granting BC's request, and they still have this active request from Toronto to do the same thing.
Well, I'm going to be really blunt here. Oh, sorry about the noise. I'm at an airport.
No, I was going to say, I appreciate you squeezing us in here.
So Yara Sachs, the Minister of Addiction and Mental Health, is incompetent and an ideologue. And this is something that, I know a lot of people who know her as well. She doesn't have a strong grasp of the evidence base. She's unwilling to listen. She has a certain idea of what we should do in Canada. And she wants to pursue that goal regardless of what we see on the ground. So I don't think we're going to see any real change as long as she's the federal Minister of Addictions and Mental Health. Given her background and given her lack of knowledge on this issue. I mean, for God's sakes, she used to be a yoga teacher, and her only qualifications here is that she had a nonprofit based on addiction and mental health. That's how they try to sell it. And when you go to the website, you see that she was advocating for mindfulness meditation. I'm sorry, we need someone who actually has experience on the job running this file.
Yeah, I think that's an incredibly valuable point here. And or at the very least, someone who's listening to the evidence and listening to the experts on this and is not so driven by ideology. Well, it's a bit of a victory, hopefully, for the people of BC who I know have been pushing for this. And we'll see if the federal government ultimately goes along with it. Adam Zivo, National Post, and more crucially on this file, the Center for Responsible Drug Policy. Good to talk to you, Adam, and safe travels wherever you're going.
Thanks for having me back on the show.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.